American Academy of Pediatrics, and like, who are their main funders? Mead Johnson, who makes formula, the company that makes influenza vaccines, Abbott Nutrition, which makes formula. You know, these people are funding the organization that cherry picks the research to make our pediatric guidelines. Okay. So there's hundreds of thousands of papers that are published every year about the importance of nutrition and exercise and sleep and avoiding pesticides and avoiding plastics in our foods. Just tens of thousands of papers every single year. But what goes into the guidelines, which are created by professional organizations like the American Diabetes Association, the American Academy of Pediatrics, who are funded by things like processed food companies, pharmaceutical companies, and then, of course, in the case of the ADA, people like Coca-Cola and Cadbury. So, you know, people will always say
Cadbury, the chocolate
company, has
funded
millions for the American Diabetes Association.
Now,
so
come on,
absolutely, this is just.
I just want to say, because I don't want to ever sound judgy or pretend that I have good eating habits, because demonstrably I don't. They make great chocolate bars. Sure. They know they're awesome. But
they shouldn't be probably influencing our diabetes guidelines, right? I mean,
is that real? You're sure that's true?
I am certain that is true. We could all.
And Anheuser-Busch shouldn't be funding, Alcoholics Anonymous. It's just like, these companies should exist.
But we follow this cult of evidence-based medicine, right? Which is that we follow the guidelines, but the guidelines cherry pick research from the canon of scientific literature that's out there, which is why when I was in medical school, there were just huge swaths of the science that I wasn't seeing.
But so can I just ask you a very fundamental question? Why would we follow the guidelines rather than the outcomes?
It's a great question.
So you just said 5 minutes ago, you were outlining this terrifying and sad and catastrophic series of stats describing the total collapse of public health in the United States. And so who cares what the guidelines are? Doesn't anyone just sort of zoom out for a second and be like, all these kids have diabetes, which leads to dementia. Like, this is not working.
Right.
Did no one say that?
Well, the question, it's not working, is the question I would basically put in front of every doctor in America. Like, if you're not looking around you and just scratching your head and saying, what the hell is going on?
Yes.
Then you are profiting off of this crisis, and I want the most dangerous thing you can do in America right now, obviously, is ask the question, why? So, I understand.
About anything.
But, this is just a point to kind of answer your question about, why is this happening? Why aren't we following outcomes? It's institutionalized to not actually focus on outcomes, because the business model of the healthcare system is volume. It's how many patients can you see, not what their outcomes are. We are paid for volume, not outcomes. Now,
did you see that as a surgeon?
So absolutely. I mean, it's how many chart notes can you write and bill every day? That's why doctors are seeing 30 to 40 patients a day with 15 different diagnoses for each one. Obviously, you can't help that patient thrive and get healthier. All you can do is write the prescription, because we are paid for volume. And the unofficial mantra of all
doctors must know that.
All doctors know. The unofficial mantra of private practice medicine is you eat what you kill, which means you get paid, you eat for how much volume you can do, how many surgeries you can sell, how many people you can get through in and out of your office. Now, back when Obamacare was coming about, they were, which was really an utter failure. There was lip service that was paid to this idea of value-based care, okay, which sounds great on paper, right? So value is good outcomes over lower cost. This sounds great. We'll get paid more as doctors if we have better outcomes over lower cost. What is the highest value intervention you can do for a patient? Get them to eat healthy. Doesn't cost a lot, has incredible outcomes universally, right? Get them to sleep, get them to exercise. We would have moved towards that. But even that was corrupted by corporate interests, because how the doctor had to report on quality was through these metrics called MIPS, basically, merit-based incentive little criteria. And most of them were based on how many of their patients were medicated. So instead of a doctor having to report quality as, I have a patient who got better, who got healthier,
which we expect,
it was how much of the patient population was on long-term medication. So the actual good outcome was defined by medication adherence in a practice, rather than is the patient reversed of their disease. Every disease
So it wasn't the actual outcome.
It wasn't the outcome. The outcome ended up being how many of the patients took meds. So even with lip service to good outcomes, it's not a healthier cell. It's a medicated patient. Those are two different things. We did not learn that in medical school.
But can I ask you, again, I don't want to get too personal, but what about the doctors that you were trained with or served under who trained you? I'm sure a lot of them are good people. I know all of them are smart. Yes. the things that you're describing would be pretty easy for anyone with an IQ over 80 to notice.
Right.
Do they not notice this?